Welcome to the Alabama Way, WPXH's public affairs program, providing a forum for local information and community support. If you'd like to be a guest on our program, please call us at 870-4404 or fax us at 870-0544.
Good morning, and once again, we want to thank you for being here with us on the Alabama Way. And this morning in our studios, taking over the Alabama Way for us, filling in, is Comedienne Joy. Joy always has some good things to bring to us, so we want you to sit back and relax and listen at Comedienne Joy. And also her dining segment is always wonderful here on the Alabama Way. So once again, thank you for joining us here on the Alabama Way.
People think I'm trash, but they're wrong. Today I'm just an aluminum can, but one day I could be a stadium.
Criminal Minds on Ion Television.
Positively entertaining.
And good morning. Here on the Alabama Way, you know the summer months is a good time that you like to have these cookouts and go to various parties, but sometimes you feel the effects of that food a little later. We're going to talk about GERD. And joining me today is Dr. Kenneth Sigmund. He's a GI specialist at Trinity Medical Center. Good morning, Dr. Sigmund.
Good morning. Happy to be here.
Thank you. All right, let's talk about GERD, because sometimes I even know with my own personal eating habits, they're not always good, I'm working on it, that sometimes we can get acid reflux, sometimes we may think it's heartburn, but you are a GI specialist and might be GERD. So first of all, let's tell our viewers what is GERD and then the difference between those three characteristics.
Okay. GERD stands for gastroesophageal reflux disease.
Okay.
And so that means stomach to esophagus washing back up of acid and other factors, other digestive enzymes. There's bile and other enzymes in the stomach that wash up, and those irritate the esophagus. They often cause a burning, sometimes chest pain, sometimes a spasm of the esophagus, and that's what we interpret as heartburn.
So what's the difference between heartburn or acid reflux or GERD, or are they all the same?
They're pretty much the same. They're really descriptive terms of that washing back up of the digestive enzymes. I guess if you really wanted to be nitpicky about it, you would say acid reflux is really just acid, and the other terms are for the non-acid digestive enzyme products. But it's pretty much interchangeable.
Now let me ask this. Now in my 20s, it seemed like I could eat whatever I wanted to eat. Hey, no worries. Now that I'm 40 plus, there are some certain things that you can't eat as much or you can't eat at all because it kind of seems to bother you.
Well, first of all, there are age-related changes in those digestive enzymes that we talked about and the amount of acid production. Plus there are things that we do as we age, the way we eat, the way we play, and things that have changed in our body anatomically, such as developing of hernias and lowering that pressure barrier that allows things to wash back up. So things do change with age.
So let's talk about the thing that, of course, I don't want to talk about, are your food triggers. Because there are some things I know for me, greasy foods, if I eat them consecutively 3 or more days in a row, I can expect to not feel so well. And my other favorite thing is movie popcorn. That's the highlight of said the movie, but I know if I eat that movie popcorn, I'm going to not feel so well in a couple of hours.
Sorry about that. But in general, things that are higher in fat content tend to cause more reflux of acid and other enzymes. They lower the pressure of that barrier from the esophagus to the stomach, and they delay emptying of the stomach. So things tend to build up in the stomach, and then there's more there to literally wash up. So besides high fat content foods, there's chocolate, unfortunately.
Hold on, I can't have my fried foods and I can't have chocolate?
Well, I didn't say you couldn't have it, but everything in moderation.
Okay.
As we get a little bit older, we tend to have more reflux. And then there are the non-dietary triggers, if you'll let me bring those up, such as cigarette smoking. And then there's some question about secondhand smoke as to whether that's involved or not. I don't think that's hardcore proven in the medical literature, but it just kind of makes sense that secondhand smoking is not good for you in general, so it may.
But you're saying smoking can.
Smoking
affect
definitely.
So how does that
worsens
work?
it.
Is it
and
just?
so does alcohol too. I wanted to get that in. Sorry.
Okay, we're going to talk about that in a minute because we're not going to be friends when this segment is over, doctor. But let's talk about smoking. How does that affect the esophagus?
Well, it does a couple of things. It lowers that pressure of that sphincter muscle to allow more things to wash up. But also, cigarette smoke itself has direct negative effects on the lining of the esophagus, just as it does on the lining of the lungs.
Mm-hmm.
So that increases the risk not just of gastroesophageal reflux, but also esophageal cancers.
Okay, and what's the deal with alcohol? Now, we know the study's been saying red wine is good for your heart, but you're saying that's no. Is it just wine? Is it beer? Is it all of the above?
Well, it's any alcohol. I think beer has a little bit higher carbohydrate content or fat or carbohydrate content, so that's going to tend to make reflux a little bit worse. Again, alcohol has a direct irritant effect on the esophagus and the stomach.
So it doesn't matter if it's the inexpensive stuff or is it the hard stuff that you mix with something else, that can be a problem.
Yeah, it doesn't so much matter what it is, it's more how much of it you take in. So anything in moderation.
Okay, so we can have a glass.
You can have a glass.
But that second glass,
Right.
we may not be able to have.
Right.
Okay. Now, what if, we see our doctor, or we may think, hey, I may have GERD, but we need to go see our doctor. He could say we could have other things.
Right. So just because it feels like there's acid and chest discomfort and heartburn, it can be other things. And that's why you really need to visit with your doctor first. It doesn't have to be a gastroenterologist to begin with. It can be your primary care physician, and that's fine because they're all very well trained to diagnose. Only if your primary care physician feels that they need the specialist of a gastroenterologist, do you really need to go in that direction. But other things can cause similar symptoms. The number one thing to be concerned about is heart disease.
Okay.
Because heart disease can also present with chest pain, and it can be a burning chest pain and can mimic the symptoms of heartburn or reflux. Other things are gallbladder related. There can be blockages of the intestinal tract, and unfortunately there can be growths, cancerous growths that can do that. So you need to start with a visit to the doctor and not just self-treat. Mm-hmm. Your doctor may want to just go ahead and treat initially, or he or she may believe that you need a little bit more testing and confirmation that it's not the other things. Check out your heart, check out the gallbladder. You may need an endoscopy to look and see if there's any abnormalities or any growths or any ulcers.
Okay, and so the endoscopy, is that how you pronounce that?
Yes, ma'am.
Is that similar to one of the other upper GI exams? Tell us more about that, exactly what that is.
An upper GI exam is an x-ray where you stand in front of the fluoroscope and drink some
Delicious
liquid.
stuff.
Yes, usually barium or a barium-like compound, and that lights up the esophagus and the stomach and allows you to see it. Normally, you don't see the esophagus or the stomach on an x-ray. And so that gives an outline of the esophagus and stomach, and it also gives a little bit of function because you can see the liquid go down, see how it empties from the esophagus, can see ulcers and strictures and growths with it. And if the barium gets down in the stomach and then washes back up into the esophagus, that's a pretty good diagnostic test for GERD.
Okay. Now you mentioned cancer, because that could be a creepy, scary word for some people. Do you have to have any other symptoms to know that it may be cancerous, or just with the upset stomach or your food coming back up?
Yeah, unfortunately, you don't have to have any other symptoms. It can be as subtle as just having the heartburn from reflux, or your appetite a little bit off, or occasionally a little bit of food gets stuck and you have to wash it down better than you used to, or chew things better. So sticking of food, worsening of any of your symptoms, weight loss, choking, more pain, are worrisome signs for early growths, narrowings and growths, strictures, growths.
Okay. And let's talk about some treatments if you do have GERD.
So probably the most common and reliable treatment is using something to block the acid production. And I think most of your listeners are going to be familiar with things like Prilosec, Prevacid, Nexium, Protonix, those medications that have been popularized. So many of them were in prescription, and now so many of them are available over the counter. And they really do a very good job of reducing acid production. They actually reduce the production of some of those other enzymes that I mentioned as well. So they're pretty good treatment for GERD once that diagnosis has been established. And if they don't work, that heightens your suspicion that it may be something else. Of course, dietary and lifestyle changes. We didn't talk about the fact that there are positional issues related to GERD too. So if you eat and you lie down afterwards, either on the couch or in bed, you lie down shortly after eating, that literally puts that pressure on the stomach and reduces the gravity pull on your esophagus, so that things tend to wash up more. So that's kind of a no-no if you have GERD. So it's better to eat and have a good deal of time to let things digest in your stomach before you lie down.
So would you recommend 30 minutes, an hour, 2 hours?
2 hours is the recommended after meal time before you would lie down. So there are positional things that you can do. There are lifestyle things, lowering fat content, reducing alcohol and tobacco use, and something we also didn't mention, and that's just obesity or being overweight.
Well, we're going to take a break, doctor, because I just can't take any more of this interview. You're taking my alcohol, you're taking away my chocolate, I can't lay down after I eat, and now you're talking about my weight. I just can't take it anymore. We're going to take a break, and we'll be right back talking about more GERD.
Criminal Minds on Ion Television.
Positively entertaining.
And we're back. If you're just joining us, we're talking to Dr. Sigmund from Trinity Medical Center. We're talking about GERD. And before the break, doctor, okay, you said chocolate is a problem, greasy food is a problem, alcohol is a problem, and now we talked about obesity. Are all factors for causing GERD. So let's go ahead and talk about it.
Well, being overweight simply puts extra pressure on the stomach, and especially when lying down. And that extra pressure on the stomach literally pushes things from the stomach up into the esophagus. So it kind of makes sense.
So let's talk about overweight. Is that a little bit or like a whole lot? Because sometimes that want to just be all dependent on the person. Because some people, they're not built to be a small frame person.
Well, everything's relative.
Okay.
And there are some people who are very thin and don't have GERD. There's some people who are very thin who do have GERD. And the same with being overweight. There's some who are overweight who don't, and there's some who are overweight and do. Something we haven't talked about yet is in females, after a pregnancy puts an awful lot of pressure on the abdomen, which puts a lot of pressure on the stomach, which puts a lot of pressure on that valve function at the gastroesophageal junction, and loosens it, softens it. Even some of the hormonal effects will loosen that valve function and create a hernia. And many ladies after being pregnant will have a hernia called a hiatal hernia. That's the junction of the esophagus and the stomach. It's a hiatal hernia, and that reduces the pressure and allows mechanically for more things to wash back up into the esophagus.
So once they have the baby, is the hernia still there? Does it close up automatically?
Usually it remains. Once it's kind of stretched out, it remains.
So are they able to have more children, or this is just something they kind of have to do?
Yeah, it doesn't affect childbearing at all. It just increases your risk for having reflux.
Interesting. And so they too would need to be tested to see how far they would go in terms of in a surgical procedure, or can they take one of the other meds that you mentioned earlier?
Well, like we talked about, there are multiple medications, and you can use antacids as well. There are other compounds besides those acid-blocking medicines that we talked about. But then I think you have to think about, are there any complicating features of the reflux? One can get strictures if you've had enough irritation and scarring of the esophagus. It can cause stricturing, and sometimes people get choked on food, and those things have to be dilated. It increases your risk for esophageal cancer, so an endoscopy is worthwhile to look.
What are the other treatments for women who may have these hiatal hernias?
So besides the medications that we mentioned, there are other medicines that are available that either coat the stomach or the esophagus or reduce acid production. But there are then some endoscopic treatments, using an endoscope to look down there. There are ways to treat that valve and make it either thicker or more effective, if you will, at being a valve even after it's been stretched out. And then there are surgical treatments. There are various surgical treatments for correcting the hernia, increasing the pressure of that valve so that it restores the function of keeping things down in the stomach and not letting things wash back up.
Okay, so with those surgical procedures, are they done laparoscopically so the downtime is quicker?
Yes, they are.
Okay. Now, we talked about some medications earlier, a lot of the over-the-counter meds. What are the side effects of taking those for a long period of time?
Well, there's not a lot of side effect, really. There have been some studies about whether people are more likely to get bronchitis or pneumonia, because one of the things that you do when you reduce the acid in the stomach is that is a bacterial fighter. So acid is. Mm-hmm. So the acid kills bacteria in your intestinal tract. And so if you block acid for a long period of time, that allows more bacteria to set into your upper intestinal tract, can possibly be associated with bronchitis or pneumonia. There are also some long-term effects of the lining of the stomach that may cause some irritation or scarring, or even early cancerous changes have been seen with very long-term treatment. And I'm talking about 10 and 15 years worth of treatment. So using those medications for a year or two is really not an issue for anyone.
Okay, so let me ask this, what about baking soda? Because I know that was a home remedy. You know, take a teaspoonful of baking soda and a little water, and then that should help. I tried sometime, burp, and I feel so much better. Is that good for you?
It's really not, and that's because baking soda is the opposite of acid. So acid is very low in pH, and baking soda is the opposite end of the spectrum. It's very high in pH, so it's very basic, and hydrochloric acid in your stomach is very acidic. And so if you take the bicarbonate, it counteracts that acid effect, but it's just as irritative on the esophagus as is acid.
So my stomach feels better.
If you take enough of it, you'll really irritate your esophagus pretty badly.
So it's okay if I do it once a month?
It's almost as bad as taking Drano.
Oh my gosh, that's terrible. I would never do that, doctor. Okay, so let's also talk about Barrett's esophagus. That's another problem that can occur with GERD?
Yes, we believe that that's related to long-term GERD, the irritation of the lower lining of the esophagus, and it undergoes changes from normal lining tissue to abnormal, and then continues to change to being precancerous and then cancerous. So it is a precancerous process that is worsened by GERD.
So that would be one of the kind of last stages of GERD, or is that something that can kind of happen at the beginning stages?
It really can happen at any time, and we don't really understand what triggers it. So many times when people come to us with GERD, we don't know how long they've had it. We know how long they've had the symptoms because they tell us, but they may have been having reflux and irritation of their esophagus for a long period of time. And why some people are triggered to have the changes of Barrett's esophagus and the precancerous lesions, and some people are not, we also don't understand at this time.
Wow. So are more smokers have it than non-smokers?
It's a little bit higher risk in smoking and alcohol, yes.
Interesting. Now, what about when you get older? Do you tend to see that more in your older age patients?
We tend to see Gerd more in older folks, and that's because that muscular function, again, of that sphincter relaxes some. As all muscles get a little bit weaker as we get older, that muscle gets weaker as well.
Mm-hmm. And so earlier, you talked about we can't lay down and after we eat. So what if you have a lazy boy? I have one of my favorite chairs at home. And so after a big meal, you want to just kick back and relax. A lot of men that are watching football game want to kick back and relax.
It's not too bad if you don't bend at the waist too much. What many of the studies have shown is that if you raise the bed or raise your head up, that you have less reflux. However, that can be counteracted by bending at the waist and putting pressure on the abdomen. So the more you raise the head and the less you bend at the waist, the better.
Wow. But you will suggest that maybe we should eat smaller portions.
Smaller portions.
More frequent?
More frequent is fine, sure. As long as you're not gaining weight with all of that. Got to keep the weight down and not eating too close to bedtime.
Wow, that's some good information. So you've heard it there from the doctor. We got to watch our alcohol, the chocolate, smaller portions, not being a lazy boy so much. But the lazy boy is better than just laying straight down in bed, though, right?
It is.
Okay.
But getting up and going for a walk after dinner is probably better than both of those.
Well, that is true. So that way we won't have to come and see you so quickly, Dr. Sigmund. We want to thank you so much for joining us this morning and educating us on GERD and how that tummy ache you can have and that indigestion may be something worse, so you definitely need to see your doctor. We have his information down on the screen if you need to contact him. And we'll be right back.
Criminal Minds on Ion Television.
Positively entertaining.
Good morning and welcome to the Alabama Way. And today is World Heart Day. And joining me this morning is Dr. Tim Lee. He's a cardiologist over at Trinity. Good morning, Dr.
Good morning, Joy. Thank you for having me today.
It's my pleasure. I think I'm going to be happy to talk to you today. I'm not sure, depending on the answers that you're going to have for me.
I hope so.
So we're talking about World Heart Day. So this is just one day that we want to set aside to say, let's have healthy hearts. How can we just take it beyond one day and make this a lifestyle?
Yeah, Joy, I totally agree. World Heart Day is September 29th, as you know, this year. And so, but taking it to every day. Healthy lifestyles, watching what you eat, knowing what your numbers are, going to your doctor, knowing what your blood pressure readings are, knowing what your diabetes levels are, knowing what your cholesterol levels are, knowing what your risk factors for heart disease is the first step. And then modifying your risk and lifestyle changes. I mean, the really big push this year for us is lifestyle changes. Things that you can do in the home, things you can do at the workplace, things you can do when you're just out hanging out with your friends, things that you can modify to make yourself healthier, make you live longer, and improve your quality of life going forward.
So let's talk about things we can do in our home. We'll start there first.
So things that you can do in your home, of course, having healthy snacks in your home. A lot of us have stocked our pantry with cookies and snacks and chips. You can bring in fruit, fresh vegetables. These kind of things, of course, would help modify your overall risk of getting diabetes and getting obesity. The other thing you can do is basically have it in your home where you're having a no-smoke zone. You have your home as a no-tobacco, basically a tobacco-free zone.
I agree with that.
Nicotine and tobacco it's a huge risk for cardiovascular disease throughout the whole world. I mean, if you look at the statistics, if you stop smoking, say you've been smoking all your life and you stop smoking for 15 years, you've lowered your risk of heart attack down to a person's level who's never smoked in their lives. Wow. Not only are you decreasing your risk for lung disease and other issues with tobacco, you're actually preventing your kids from getting secondhand smoke, which is a huge risk factor for people. Secondhand smoke can kill you as well as being the primary smoker. So that's a huge thing you can do in your home to help you.
And when you say secondhand smoke, what if the person smokes outside? Are the other non-smokers still affected some or not as much?
That's a good question, and I can't answer that with any scientific evidence. I think it makes sense if you're in someone's direct contact and you're actually breathing in the fumes. Mm-hmm. I think that is more problematic than, say, if you're outside. You know, every hospital that I worked at in this recently has a smoke-free zone. So you're not smoking around the patient and the family member's entryway. Right. They have a designated area. And so I think in that sense we are kind of decreasing that risk as opposed to direct inhalation. of the smoke itself.
Now let me ask you this, because you have a lot of teenagers.
We do.
Who, some of them may not be fresh fruit friendly.
Yeah.
How can parents encourage them or kind of force them to say, let's trade in that greasy burger for some carrot sticks?
Good question. I think the biggest thing is just to set the example. The children are typically going to do what you do and what they see you doing and what lifestyle you have. I have 2 7-year-old twin daughters, Lauren and Jaden. Hello, Lauren and Jaden. But I think at the end of the day, it kind of mirror what you do. And if that didn't help, I suppose there are other things you can try. Like, I mean, if as a parent, I think you're still going to have more power over your kids than most anybody else. I would say in the school system, at least, I think they've been a big push in recent years towards getting healthier snack choices, getting away from some of the sugary drinks. And a lot of the schools here locally have cut down on some of the snack and other options and making it more health friendly. I mean, this is a lifestyle you're talking about. When you look at the progression of coronary artery disease, when you look at even small children, they've done, and I won't get too gross with this, but they've done autopsies on kids who've died traumatic deaths in their teens, and they've seen that there's been fatty streaks developing, early plaque formation in these young kids. So you would think, why does this young child have coronary artery disease? Well, coronary artery disease does start at an early age. So knowing that helps you modify your risk. Okay, so I would encourage any teenager not to smoke. I would encourage teenagers again to eat the healthier food, the carrots, the vegetables, the rutabagas that we had to grow up eating when we were kids.
Right.
So I think all this is going to lead towards being healthy children. If you look at the risk of obesity, I think that's one of the biggest things that I see in teenagers and small children these days is that the obesity is an epidemic, and you got kids eating these high-calorie junk food type meals, and they're getting to be, and then you combine that with physical inactivity. They're watching a lot of TV. I think if you aim for less television, and children will mirror what you do. If you're out walking, get your kids to go walking with you. Go out and engage them in more healthier activities and provide that healthier food choice in the home. And that's where you start.
And then you talked about in the workplace. What can we do at work? Because most days you're at a place, they want to give you more work, obviously less pay, but then you're sitting there trying to get all your tasks done, and now I got to be healthy while I'm here these 8, 9, 10 hours.
I think most employers, at least in these days, are very sensitive to that with a lot of the insurance benefits that you can get by having your employees enroll in healthier enrollment health lifestyle plans. One of the things that you can do is when you're at your work desk is you can take the stairs. When you're at your workplace, you can take the stairs and instead of taking the elevator. If you take the public transportation, you're likely to maybe you can stop maybe 2 or 3 blocks out from your usual stop and walk part of the way in, or better yet, bicycle your way in or walk in. Just getting more activity. You're trying to get your body to be more, get more exercise in. Some would say there's been some programs that they have at some hospitals where you're getting pedometers, where you're measuring how many steps you're taking. You're walking and actually measures your number of steps, and you can count it. There's apps on your phone you can get these days, so there's really no excuse. You don't have to invest any money. Everybody has a smartphone these days.
Well, most people. I still run across
most
those
people
flip
do.
phone people.
Most people do.
Okay, so what about stress? Does that contribute a lot to cardiovascular disease?
I would say it really does. There's a lot of published data about stress, emotional stress, physical stress. I think if you look at men and women and how we differ in terms of our cardiovascular risk, it seems that women are more likely to have worse cardiovascular events associated with emotional stress. And that has to do with women are being the primary caregivers. Oftentimes they're asked to do a lot with the kids. They're running there. They're working a lot of times inside and outside of the homes. At the home, I have a wife who works 3 jobs, I think, and she's very, very busy. So I can see that as a husband, I can see that my wife does a lot of stuff that I couldn't even halfway do if I tried. So I think that when you look at emotional stress, psychological stress, I would say it's very important. There's actually a syndrome that we see now called Takotsubo, which is called the broken heart syndrome, or stress-related cardiomyopathy. It has to do with people having a stress-related event, and all of a sudden their cardiac function will decrease suddenly. And it's not really well understood why it happens. It's probably a combination of catecholamine, epinephrine, adrenaline, and these different type of other inflammatory components. I think it's still some research is still going on. But at the end of the day, that particular syndrome, the broken heart syndrome, the Takotsubo, can be fatal. I mean, it can be very low risk of it, but it is a clinical syndrome that is directly linked, has been directly linked to stress level. So I think that stress is very important, and modifying that either through daily exercise, yoga, tai chi, walking, anything you can do to kind of decompress your day. Massage therapy, even if you take that.
Well, I love that.
It's all about just kind of finding that good balance. So to answer your question, I think stress is a big factor. When you look at it from even in some molecular levels, they've looked at different cytokines and inflammatory markers. I won't get into specifics, but things such as CRP, C-reactive protein, which is a marker of systemic inflammation that has been linked to cardiovascular disease. When you look at those kind of levels, they're sometimes high, and I think that has been kind of linked to other stress conditions, particularly in certain ethnic groups, particularly African Americans, which some researchers would argue we have a baseline higher level of stress just living than some other ethnicities. But that's a discussion for a different day.
Now, you place a lot of stents in patients.
I do.
What are some symptoms that people may have before they even have to come and see you?
That's a good question. I think it's a very good question. Some of the classic symptoms of coronary artery disease, and that may vary from gender-specific, men and women have different symptoms. You hear the man more often to complain of the elephant on my chest symptom, and that is not always the case with older people or women. They could be something as simple as a little bit of fatigue, or a woman may say, I'm having a little bit of indigestion. That indigestion, or my back's hurting, or my arm hurts a little bit. I've had patients complain of jaw pain. I've actually had a patient once can tell me that he needed to have a tooth extracted, when in fact that tooth pain was his angina. And it wasn't a decayed tooth, it was really angina, heart pain that was manifested as a jaw ache. So, and I think I hope I'm answering your question, but the thing that you want to realize that before you get to those symptoms, you've got to recognize that there is a course of events here. There are risk factors for coronary artery disease, that some of those risk factors are things that we can modify, and some of those are things that we can't modify. For example, the ones that we think of classically as cardiac risk factors are hypertension, high blood pressure, we call it, diabetes, hyperlipidemia, tobacco, smoking that we've talked about earlier. Those things you can modify. You can get with your doctor, you can stop smoking, you can keep your diabetes in check, keep your hemoglobin A1C down the target, get your blood pressure readings down the target, keep your cholesterol down the target. Things you can't change your genetics. If your mother, father, sister, or brother have had heart disease early in life, say in their 50s or 40s even, that's a risk factor for you. And so that is something that you can't change. You can't change getting older. As you know, coronary artery disease will become, the incidence of it goes up with aging. It's just God blesses you with years on this earth, you will eventually get coronary artery disease more than likely. 1 in 3 women die from heart disease. And I think that the symptoms are so vague sometimes in women, you may miss it. So you have to have a clarity of thought. When you're listening to patients coming in reporting these symptoms, know what their risk factors are, and kind of know that you have to really kind of ferret it out. Sometimes it's very difficult. They don't always come in telling you that I get this every time I do this, I get this chest pain or this symptom. Sometimes it's just a little bit of shortness of breath, and you have to be very mindful and listen very closely to these patients because it can save their lives.
Wow, that's some great information, Dr. Lee. We want to thank you so much for joining us. If you want some more information on World Heart Day, you can look on the web, and that's worldheartday.org. So thank you so much, Doctor. Hopefully I won't have to see you soon.
Well, hopefully not.
Exactly.
Thank you.
Well, we're going to take a quick break, and we'll be right back.
People think I'm trash, but they're wrong. Today, I'm just an aluminum can, but one day, I could be a stadium.
Criminal Minds on Ion Television.
Positively entertaining.
All right, and we're back. Thank you so much for joining us. Right now, Alabaster is getting ready for the Little Warrior Race. And I want to have my good friend Jamie Parker here to tell us all about it because it's such a heartfelt story that goes along with this race. So thank you so much for joining us this morning, Jamie.
Thank you for having me.
All right, so first of all, tell us how you came up with the Little Warrior Run.
Well, we had twins in October 2013, Michaela and Wyatt passed away after 4 days. So I was on maternity leave with Michaela and just trying to think, what could I do to honor my son? What could I do to assist the people who assisted us when we went through this tragedy? And I just thought, well, people really like to run for some reason, so maybe a 5K. So my husband came home from work and walked in the front door, and I looked back and said, hey, you want to put on a 5K? Okay, so that was kind of the start of it. We just kind of went from there. It expanded very fast.
Well, that's good.
Yeah.
So I think you, when I heard you share your story, that you were at Brookwood and some of their nursing team helped you to get through the loss of a child, because I'm clear that that wasn't easy, especially with the newborn. Did you have any idea of he was ill or anything like that before he passed away?
Yes, we found out at 14 weeks that he was very sick. They continued to tell us that, oh, he'll pass away, in utero and all that, but he made it to birth, and he was very, very happy despite the pain that he was in. He smiled the whole time. We have pictures of him, and the comment I kept getting from people was, I've never seen a newborn smile, and he did have a smile on his face, so he was happy to be here. He was happy to hear his daddy's voice all the time. So after he passed away, the lovely ladies at Brookwood Hospital, they immediately stepped in and started helping us. They have a group called the Family Support Services Group. They're part of the Brookwood Medical Auxiliary. And their primary function is just to come and, help people after a loss, whether they lose late-term pregnancy, stillborn, or even an infant after the fact. They come in and, what do you need? Where do you need to go? And let me guide you. Because without that, we wouldn't have any idea what to do. You can research it all you want. You know that your baby's sick, and you know that, you're most likely going to have to take measures afterwards, but that's about as far as it gets, so you don't really know what to do. So they're the ones that stepped in at that point and helped us.
So what would you say was maybe one or two things that they did to really help you to overcome and then to be able to honor your son as you're doing now?
Well, they helped us make funeral arrangements, which was huge. That was just something that I 100% didn't want to deal with, didn't want to have to deal with it, and just didn't know what to do. So they did assist us with that. They also gave us a memory box that had, he had a hat in it, and they took pictures of him. They gave us a lammy, which is our daughter's favorite stuffed animal. And, everything that he used while he was in the hospital, the wonderful women in the NICU, they made him a card. So we had all that as a keepsake, and that was something that I just really felt was very meaningful. After we went home and we started meeting people that had gone through a loss, that was one thing they really told us was different about maybe their situation if they had a bad experience. Aside from the whole experience is bad, but you really need people to be strong for you and be there for you. And a lot of people at other hospitals had run into, okay, you lost your baby, and I'm very sorry for that, but now it's time to go. And they didn't know what to do after that, and they didn't have any memories of their child. We have the Now I Lay Me Down to Sleep, and a lot of hospitals use that and take pictures and things like that, but they didn't have like the little keepsakes that we got. So that was one thing that we were like, well, we want to make some money to help them continue to do that. We thought that was important.
So does some of the funds from the race goes toward that?
All of the funds, yeah. Any profit that's made from the run goes to the Brookwood Medical Auxiliary. And at first it was, okay, we can help them continue to give memory boxes or, get more volunteers or whatever. But it actually kind of blew up from there because we ended up making about $10,000 to donate to them. And they were able to, they're going to be putting on a conference on October 2nd of this year to assist families after a loss. The conference is called the Wyatt Parker Memorial Conference, and it'll be in Vestavia. And they have called professionals to come in and guide medical professionals who assist families after a loss with how to actually assist them. So that's what the conference will be for, and we're hoping that it'll expand to other hospitals. They did say that they've gotten some registrations from other hospitals to kind of guide them and show them what they should be doing and what is good practice, and even pregnancy after loss. That's a very, very hard thing to go through if you've been pregnant. Yes, it's a joyous occasion, but it's terrifying the entire time. Right. So helping medical professionals with that as well. So that's what the money will go towards from last year, and then we're going to raise money this year to just help them continue doing whatever they need to do to help families and also help the NICU at Brookwood.
That's awesome how you would take a tragedy and turn it into such a wonderful thing to be able to help other people.
Thank you.
So do you offer a support group as well?
If you go to our website, which is www.thelittlewarriorrun.org, we have a tab on that that is for resources. It's got any groups that we've come across. The Amelia Center is a great resource for people after a loss. Any events that we hear about, other 5Ks or other events for families, we put that on there. We've gotten a list of books and websites. So that's all on our website that people can see at any time.
So for someone on the outside, may have family or friends that may have lost a child, in your opinion, what is the best way to, to support them? Is it to bring up the memory of the child, or you don't say anything because you may be concerned that you'll upset the person?
I think everybody's different, but I know what I've heard most in our situation is that, just honor their memory all the time. Don't be scared to say their name. Just say, hey, I'm thinking about Wyatt today. Or, hey, I was thinking about you, how are you doing? And you may just get I'm fine, and they shut down. And that's okay, but at least they know that people are thinking about them and people are remembering that they had a child. I think that's really, really hard for parents when they lose a child and it becomes I'm really sorry, and then nobody remembers them after that, or they remember them and don't want to say anything.
Right.
You want people to tell you, hey, I remember they existed, and I'm there for you if you ever need anything.
Okay, so tell us about the race. So if people want to join in, to be part of this, what do they need to do?
So you can register the day of the run. It is $25 per person, and the run will actually start at 8 a.m. at Veterans Park in Alabaster. So you can come. Early registration starts at 7:15, so you can get there and register at the time of the event. And we will also have vendors and food trucks and vendors for shopping and things like that. So even if you just want to come, you don't necessarily want to run or walk or anything like that, you can just come and enjoy the community time. We're going to have a dove release at the end and awards and things like that. So it'll be a really good community event in general, whether or not you want to participate in the actual 5K.
So I did hear the key word. You say you can walk it if you don't want to run it. So you're talking about me there.
Yes, myself as well.
Because I didn't know if you all have someone out there to help you train, because I know that some runs, they may have on the website a training program or maybe have some type of competition or anything like that.
It's anything you want to do. We have awards for the people that really want to go out there and give it their all. Track Shack will be timing it because there are a lot of people that are very interested in their time and winning awards. So we'll have all that there, and you can choose whichever route you want to take. You have an hour and a half to complete it if you just want to leisurely walk it as well.
Excellent. And give us that website where they can get more information one more time.
We have www.thelittlewarriorrun.org, or you can visit us on Facebook at facebook.com, The Little Warrior Run.
Excellent. Thank you so much, Jamie. I want to wish you so much success with that run, and hopefully you all will show up and be a part of that, or just support the organization that she's benefiting from, because it'll help so many mothers and families out there. Thank you so much for joining us, and we're going to take a break. We'll be right back.
Recycling works for me.
Recycling works for me.
Recycling works for me.
Criminal Minds on Ion Television.
Positively entertaining.
And welcome back to the Alabama Ways. You all can see I went and got me a bodyguard throughout the commercial break, but I actually want to introduce you all to my good friend, Gaurdian Michael. He is an Alabama actor that is performing in an Alabama movie. Yes. Good morning, Gaurdian.
Good morning.
I am so glad that you can make it with all these muscles over here. I know some people are probably waking up saying, whoa, that's a big guy. But you're starring in the movie BloodType, that is an Alabama-based and made movie. So tell us about that.
Yes, it is a movie made by the executive producers Kevin Wayne and Millerad. it's a sci-fi, it's a post-apocalyptic sci-fi drama series. And I am privileged enough to be a co-star in this movie with Kevin Wayne, Millerad, Dallas Taylor, and Don Swayze.
So what part are you playing in BloodType?
I am playing a character called Knight. He's over part of a group of people that protecting some other survivors of the apocalypse. And the great thing about this, why one of the reasons I have such strong feelings about this movie, is that my part in it was originally, the character originally died in there, but they like what I brought to the table so much until they stopped production, rewrote the script, and put me as a permanent character in there.
Wow, now that's awesome. You sure you didn't scare him?
No.
Because I think if I would see you, I would like, let's start over so this way he can live, because this is a big guy. Now let's talk about now when can we see the movie? This fall, we are supposed to show it in a local theater for 2 days. We'll show the first 5 episodes before it goes to television this winter. Okay, awesome. Now, before BloodType, you also starred in some other movies. Tell us about that.
Well, my first one, I was in a movie, Take a Chance. It's still in the works to come on. I was in there. That one I was kind of downgraded in because I was too big to fight. It was a movie that was full contact. And I outweighed the largest man over 100 pounds. So they didn't want anyone to really get hurt. So I became a featured extra.
Interesting.
Yeah.
Now, was there another movie before that you started?
No, well, time back I was in one called Giving Up the Game. It was a local movie here. And I played like a henchman in that one. But after Take a Chance, I later went, some years passed, I had this passion for acting. I didn't know if I had the talent. So I took some acting classes, and they said that I felt that I was very talented. So I ended up going to Tennessee to audition for a movie, got picked up for 3 and did 2.
Awesome. So for the average person that may be watching this, say, you know what, I want to be an actor myself. What is it like, or how difficult is it to go to an audition and to get selected, and then to go on with a great career?
What you need to do is, first, like everything, you need to educate yourself. You need to know, take acting classes, knowing how to engage the set actors, what to not to do. You need to know the lingo and stuff to be able to communicate with the people that you'll be talking to, going to audition to. They tell you slate away. You have to know what you're doing. That's all a part of being an actor. So you have to know what you're doing and get there and really have that character and, get that character to life. You bring that character to life yourself. You take it in, you read the script, and from that you form something in your head about that person and become that character. So
out of all the movies you've done, have you always been like the big bad guy?
Well, my size is always a focus. I did a comedy. My first comedy was Tuesday Sunrise. And I enjoyed that, but a lot of focus is on my size. I don't all the time I am kind of an opposing guy, but I get to do a wide span of things, Sometimes it's involved fighting, and sometimes just my gestures and things I say and do to bring a more comedic response to it. So.
Well, let me ask you this, because we were talking, and you say you were not always this size.
No.
So kind of walk us through before, since we see the after.
Well, I graduated high school at 166 pounds. I went into the military. I caught pneumonia and chickenpox. Wow. And I was down to 144 pounds out of boot camp. But I was despised being so little. So I would go to the gym and I'd ask the big guys, what do I do? They just eat. Just eat and work out. That they wasn't telling me.
Eating and working out. Well, okay, we're not talking about me. This is about you. Go ahead.
They weren't telling me the science of it, so I decided I just bought me some large jogging suits, put on and covered myself up. Hit the library and taught myself about fitness and nutrition. And I had this goal. I just wanted to be massive. It was big. So I taught myself that, and in 6 months I had put on 50 pounds, and then went on to that. I hit like 200, 225, 275, 305, and I stayed around 275, 305 while I was in the military. And a while after I got out, the heaviest I've been is like 376. So I go up and down, depends on what's going on, from around 350 to, up and down. Play around that on each side of that.
So how much can you lift? Because those are some big guns.
The most I've bench pressed was a little over 700 pounds. So
I'm pretty sure wherever you go, most people kind of stop in their tracks.
Yes, I get approached all the time, every time.
So does that bother you?
No. I'm excited to do it. I have an opportunity to speak to people. A lot of times, if I can help or engage people in a certain way, certain things are going on with people and different things in life. And a lot of times that open up conversation. I'm able to, either share my testimony with them or help them, give them tips on fitness and nutrition to help better their lives and help with certain diseases they may have, like diabetes and high blood pressure, heart disease.
Now, do you have any of those?
Well, I was exposed to some chemicals and when I was in the military, and which caused an array of problems for me. I went through some things, was down sick so much to one time I was in a motorized wheelchair. I was on constant oxygen. I was on almost 60 medications a day, and some of them I had to use multiple times. I had to use a voice amplifier, and it had gotten to a point to the doctor one day just walked in and said, at the rate I was going, I don't see me living more than a year or more.
And how long ago was that?
That was, over 5-6 years ago now.
Wow,
yeah.
Amazing.
Yeah.
You look truly like the picture of health.
Yes. I wouldn't accept that. That's when prayer ends up come in. I told God that I was, if it was my time, then I was ready. But if not, then restore me to some things I can enjoy in life. So prayed about it, and he, in the time that they gave me for my death sentence, I went into the gym with an oxygen tank and a walker and won a bench press competition. So it's just been going up since.
Wow, now that is amazing. I'm sure the devil saw you fighting back with those guns, and he's like, hey, you won this round.
Yeah.
So Facebook you'll have a Facebook page for BloodType where we can kind of stay connected and know when it's coming out.
Yes.
What's that page?
It's a BloodType web series. And you go to either that, you can go on the net, or you can Facebook. And I heard if you Facebook and like our page, you do that, then you'll be able to get notifications on what's going on with the actors here and when we are going to show the movie, do autograph signings and stuff like that. So.
Well, awesome. Well, I can't wait. I'm going to go ahead and click on. We want you to look for that also on Facebook so we can get this little person's autograph. And if the movie doesn't go well, I think I'm going to hire you to be my bodyguard.
All right there.
That'll work. Thank you so much for joining us on the Alabama Way. We'll see you next time.
Criminal Minds on Ion Television.
Positively entertaining.
All right, everybody knows that this is my favorite food, good old fried chicken. And come with me as I take you to Mount Laurel as I found a new spot for some fried chicken. Oh, that was terrible. When I'm not live on location, you can always catch me here at Jet's Pizza, eating a square of their deep dish pizza.
It's time for Dining Out with Comedienne Joy.
What's up, everybody? This your girl, Comedienne Joy, the Queen of Clean, with another edition of Dining Out with Joy, where everybody knows I love fried chicken, and in a Harris Chicken Deluxe in Mount Laurel, they said they invented the chicken. Well, Comedienne Joy sure know how to eat a chicken.
Just want to make sure everything's coated, all the little nooks and crannies.
There's nothing like delicious, mouth-watering fried chicken. And at Mr. Harris Chicken Deluxe, he's got the secret recipe with the newest trend of hot chicken.
Medium sauce. We all make these in-house. We have a hot, and then we have an extra hot.
And look at the size that you can get with your chicken.
That's mac and cheese with cornbread baked on top of it. It's corn on the cob we do. It's just a mixture of all these summer vegetables, corn.
Now, if you're watching your weight, Mr. Harris also has some rotisserie chicken that will melt in your mouth.
But you really want to make sure it gets that good kind of caramelization on there, because that's all the flavor on the outside.
And the countdown is on because dinner is ready. Yes, sir. That looks good. That golden brown. This right here, this is the best chicken in all of Mount Laurel. Let me tell you, y'all need to come out here and get this crispy chicken right here. Oh my goodness. You come to Mr. Harris, you can't play with this wing tip. You got to take it to the business. Look at that. And look at this right here. You know, got to flip it over right here. That's how you do the wing tip. I can't leave nothing left. Chef, can I salt my cornbread and my greens? Do you mind?
I'll hope you do. That's what... Buttermilk biscuits.
From the buttermilk biscuits to his famous peanut butter banana pudding, everything in Harris Chicken Deluxe is homemade, fresh, and hot.
All right, Joy. I need you to try this. I want you to tell me what you think.
All right, now I don't want to hurt your feelings, so I'm going to go ahead and try it, just because you asked me to. All your food is me buckling. You see my knees getting weak now. That's some good stuff. Mr. Harris' motto is respect the chicken, and I think I gave the golden bird plenty of honor. You leave now the back evidence behind. Look at the chicken. See, I even know how to eat a wingtip.
People think I'm trash, but they're wrong. Today, I'm just an aluminum can, but one day, I could be a stadium.
It is always good when Comedienne Joy is here on the Alabama Way. And listen, once again, we want to hear from you. If you've got a comment or you've got a topic that you want us to hear or bring to you here on the Alabama Way, let us know about it. You can write to us here, 2085 Golden Crest Drive, Birmingham, Alabama, 35209. Once again, thank you for being here with us on the Alabama Way.
Thank you for watching the Alabama Way. The views expressed in this program were solely those of the guests and not of the station. For questions or comments, write to us at 2085 Golden Crest Drive, Birmingham, Alabama, 35209, or fax us at 205-870-0544.